Let's talk about how to actually pick a heart doctor without getting played by the system. I'm Dr. Evan Levine, board certified cardiologist. If you enjoy my videos, like, share, and follow. And what goes without saying, everyone should be board certified. Now, most doctors can only send you where they're affiliated. If you want the best surgical staff, the doctors that do the best procedures, you pick the hospital first and then find the doctor who works there. And never let your insurance company dictate your health. Choose your doctor, then choose the plan that covers them. And if your insurance drops your doctor and you're able to, you drop the insurance. If you're able to. The experience. There's a lot of young kids coming out of cardiology fellowship. I think it takes some time. It takes a few years for a specialist to develop clinical eyes and to understand the nuances of patient care. So if doctors left and you're sent a brand new doc, maybe you should consider going elsewhere, asking for the seasoned doctor. You want someone who's been at it at some time. I prefer groups also owned by major top hospitals and not ones bought by major insurance companies. Here's a hard truth. If you live in a low-income area, be very, very cautious of these solo clinics. I've seen it too often, doctors taking advantage of the less educated by ordering a mountain of unnecessary tests, often on low Medicaid reimbursements. It's predatory. It's dangerous. If you have to take 2 buses to get to a clinic in a better part of town or a university center, try and do it. Your life is worth the commute. Other things I'm seeing are some doctors in the similar areas opening up these vein clinics. Now, if your cardiologist is suddenly pushing cosmetic vein procedures or leg screenings every time you walk in, be highly skeptical. Unless they're a dedicated top-tier interventionalist and then a vein specialist, they're usually just chasing high reimbursement filler work because they can't manage their overhead. Some of them even suggest they took training at advanced institutions, but be careful. It may be just a course. And finally, respect your own time. If you're waiting over an hour every single visit, they don't value you. Now, of course, there are exceptions. Surgeons who just got pulled into an emergency room, well, you have to give them that exception. Everyone else is just poor management. And check their tech. If their company computer doesn't talk to the local ER or the other hospitals, they're practicing in the dark ages. You want a doctor whose records follow you. Demand excellence. Check the affiliations and don't let the billing department be your doctor.